The thoughts of Dr. Ragupathy Veluswamy, the CEO of GKNM Hospital Coimbatore on transforming India's healthcare through innovative leadership has been featured in one of the most prestigious medical journals, Physician Leadership Journal. Dr. Ragupathy is the only Indian CEO to have his views carried in this journal, and in this article he has spoken a lot about the changes that he has made in the hospital's administration since he took over as GKNM's CEO. We have with him right now, and he is going to share more about his thoughts on transforming India's healthcare and how it could be done in all hospitals. How and where could India improve its healthcare system?
Health systems, physicians, and all other healthcare providers have to be ready to face any crisis as and when it happens. Perfect example is COVID-19. When the pandemic of COVID-19 hit us, we didn't know how to diagnose, manage, or treat patients. We learned as the pandemic progressed. Going forward, in future, the consumer demands are going to increase. Actually, they will decide what they need, when they need, and that is going to be the norm. In other words, consumers will accelerate the speed of change in healthcare industry. Already across the globe, most health systems are transitioning to healthcare IT, cloud and data analytics tools that helps to create a robust digital health. Digitalization of healthcare is more important today than ever before. Digital health includes health information technology, wearable devices, telehealth, telemedicine. Having said that, we have to realize every individual's healthcare journey is different. We have to be reminded of the fact all the time, and we have to tailor our needs. In other words, tailor the needs of the patients. When we start using virtual care, artificial intelligence, and any other technologies, so the medicine will be personalized. That's most important. At the same time, we have to remember technology is just an enabler. It can never replace the experience and the skill set of the clinician. Future of healthcare is going to be provided by a team of people. It has to be a coordinated care. Next one, we have to remember that right now most of us are focusing on treating sick patients that we call in healthcare acute care. We have to move away from acute care to promotion of health. It can happen only when we start having a holistic approach. By that I mean combining acute care and chronic care, clinical and non-clinical care, physical and psychological wellness. Now, at this time, I would like to say that in India, we have to focus also on integrative medicine. Integrative medicine, by that what I mean is, there has got to be a strong relationship, professional relationship between the patient and the physician. And both of them sit together and decide about the conventional therapy and alternative methods of treatment, and they should select what is best for the individual patient. Next thing we have to focus also is that when a patient or anybody goes to the hospital or seeks health care, they want to know how long they're going to live. Is the treatment going to help me? Will the treatment help me to lead a normal life or at least near normal life? In other words, they're looking for what is the outcome. Outcome is a term used and practiced very well in Western countries. Outcome is nothing but is a result of healthcare provided to the health of the individual over time. In other words, it measures the effectiveness of healthcare provided in terms of admissions, readmissions, infection, functional status. That is about what I said earlier, about how long will it help me, will I need a normal life. That is a functional status. And also patient experience and cost. This is the most important thing. It's called outcome revolution. It is happening in the Western world. Unless we provide good care focused on the outcome, there is no point in giving acute care to all patients. We have to tailor the needs of the patient so that patient will be able to perform normal or at least near normal as opposed to the previous condition of the patient. Then we have to think that yes, healthcare is complex. At the same time, there is enough opportunity for a lot of innovations. I see going forward in the future, a lot of complex treatment will be guided by genetic analysis. More and more demands will be coming from patients and their families. Doctors have to face that. And more demands will be placed on healthcare institutions to be transparent and reliable, and at the same time demonstrating care and empathy. Is it possible? It is possible. How? That is why right from the beginning I said coordinated care is what is important in this complex healthcare delivery system. When you think about the current advances in technology, medical research, you will realize that no one individual can remember everything and implement the care. So coordinated care becomes more important than ever before. Is it possible? Again, I'm saying it is possible, provided we all focus on what we do every day. I believe being passionate of our daily work can help us achieve the impossible.